In 2017, I was pregnant and had a easy, it was my second pregnancy, so thought all would go well. And I got to 20 weeks, so I was showing. And when you have your second, you're much more prevalent. And I happened to be in a business meeting, and I got a call at 4 o'clock, and they said that they had just done a test and something didn't look right. And I can't sleep that night. I ended up actually using Maven because I wanted to at least get some type of security. And so I talked to an OBGYN at the time on our platform, and he said, listen, you don't know anything until you have the information. It could be a lot of things. So, get sleep, you'll figure out what this is. It's a test. It's something you need to do. So next morning I fly home. I finally get in touch with the office, and they say, we need you to come in as soon as possible, and we need to do an ultrasound. And I said, why? And the woman on the line said, there's a very good chance that your baby is dead. And first of all, she didn't ask where I was. Happened to be in my house, thank God, alone. My husband was somewhere else. He was at a funeral, actually, for something different. My daughter was with my parents. Thank God I was alone. Didn't ask, what if I was driving or if I was somewhere else? And in that moment, it was like one of the questions of holy cow, this is happening to me. I work for Maven. I help other people with this, but now I'm going through this. I'm 20 weeks. What did I do? This is my fault. I've been working too hard. Maybe I didn't take my prenatal vitamins. I called my husband. I said, you got to get here. They're saying that something's wrong with the baby. We go into the hospital, and you lay in a room, and they put a big screen up, and they pushed it up, and the lady's, looking at my stomach and says, there's no heartbeat. I'm so sorry. Again, you're having an out-of-body experience, and you're like, this isn't happening. I already knew, it was the only one that knew what the gender was. So I knew it was a boy. I already had a name imaginary and picking it out. So you're already all of that, the pictures in your head are just off. And then immediately you just want to get it out. And I shared this just because it was such a horrible experience of how I found out. And don't you betcha, I wrote to them and I told them about it. What I didn't know, and again, this goes back to information, and was what was going to happen afterwards. So you get a D&C, which, by the way, is not it's not a comfortable situation. You go somewhere to get surgery and you leave without a baby. And I was really sad and depressed for a while and had to talk to a lot of people to do such. So I used Maven, for those things, and got back on track. Up until this time, I've been only using exclusive fertility because when I was 16, I was told, you have PCOS, polycystic ovarian syndrome, and you're probably not going to be able to have kids when you get older, and you're going to have trouble. And you also have thyroid problems. So I always, at 16, I'm being told this. I don't even know if I was sexually active at the time, but let's just say, but you're going through this knowing that this is going to be something against you. So as soon as I met my husband, we got married, we started having kids, it was all IUI. So after I have miscarried, I'm ready, let's go do this again. I'm ready, let's do it. So we go back through IUI, I do 3 rounds. All 3 failed. Meanwhile, the other 2 pregnancies were quick. So I'm like, what's going on now? Right now I'm feeling like a failure. And then I remember at Maven, we talk about how you don't always have to go through fertility. In fact, 30% of our members end up getting pregnant naturally because they figure out that there's some underlying condition, and honestly, it could also be mental. So I said to my husband, I go, you know what, let's just give it a try, for a month, and do it the natural way, and follow something and do it. And I'll never forget being in the bathroom. You go through the exam, pee on the stick, whatever, and it showed up. I was pregnant, and I was like, we did this by ourselves. This is amazing, But here, and I thought about it, and I want to open this up for conversation because I think there's a lot of, and I'd be curious if you're even seeing this in the VC world. A lot of companies want to get into this fertility space, but I believe they're leaning in with, here, go. And even direct to consumer is pushing, go freeze your eggs, go down the fertility route. And I don't think that should be your first stop.
Well, thank you for sharing your story also. I mean, it's so raw. I'm still processing, but it takes so much strength to go through that and to talk about it and to be so open about it. And so I'm just grateful to hear your story and that you're doing okay. I think it's so true because it comes down to incentives to your second question, which is fertility clinics are very profitable and they are incentivized to increased cycle throughput, very similar to how providers within health systems are incentivized to spend their time performing surgery, doing, the most highest reimbursable type of care, which is often why women don't get the level of bedside manner and care that they might like to have when they're getting really sensitive information, because that's not incentivized in the system. In fact, it's disincentivized, and part of the reason why OB-GYNs are so underpaid relative to their expertise as surgeons, because they tend to spend more time with patients than the system would like them to. We haven't really done a lot to ensure that women build trust with their providers, and we don't really do a lot to set women up to trust their providers. And on the flip side, it's really hard for providers to allocate the time that's really needed to build that trust with patients. And healthcare workers work really hard.
Yeah.
And it's not like they go into medicine to not care for patients. And so we want to give everyone the benefit of the doubt in a system that hasn't really been designed to encourage women to get the best care that they should get, and to encourage providers to be able to show up as their best selves for women. I so relate to what you experienced on a totally different front condition-wise, where I had a 10 plus year delay in diagnosis for an athletic injury. And I spent 10 years in physical therapy and did all kinds of things and never got an MRI. Was never given an MRI.
10 years?
For 10 years. And it's because when you grow up, you see different physicians at different ages. There's not necessarily continuity of care. You have repeat injuries that become chronic. But when the chronic injury isn't a break, it's not a fracture. It's the standard of care is, physical therapy, rest. And it takes someone to look at that history of 10 years and say, you're young, something's not right here. You shouldn't have pain every single day. And I ended up having to get double ankle surgery, full ligament reconstruction, because the integrity of my ankles was just gone. And I looked at myself and thought, well, why didn't I advocate for an MRI? Why didn't I ask?
Oh, so it's every one of these stories is just so classic for the multitude of layers of what happens. And when I'm in an optimistic mood, I'll say, okay, we didn't know. We didn't know to ask. I'm a little less patient. But are you kidding? We still don't have the data. Women's sports since Title IX has been a priority, right?
Yeah.
So
I think the comment, don't believe in your story,
right.
Yeah. But don't glad to know.
Yes.
You have to know and hear each other's stories so that we understand and reshape what is normal. What does normal mean in women's health? And that's a really multi-layered question.
And what is acceptable?
One of the things, I don't know about you, but since doing more work in the space and talking about it with friends, actually friends do share their stories in a way where they're, I never told anyone this, but I had PCOS, or I had really bad period pain and had to, miss days of work, and I didn't know. And so I am glad we're talking about it, and I'm glad we're building the awareness.
Yeah. And to get rid of the shame, the first thing you thought is, what did I do to have, a pregnancy end this way? What did I do? And women can't start with, I should have asked. But until we go foundationally back to asking all the questions as we speak about that, don't accept a lack of knowledge as being okay. Don't accept the male model as being okay. One last example, there is, you've all heard the expression heart failure. So we think of it as a muscle pump that's not working well. Women get heart failure completely differently, right? Their muscle gets thick and they don't relax well. So imagine a whole career where when women would come to us and they looked like they had heart failure, but we would do the test and their heart muscle was firm. We would tell them it's in their head. Maybe they need to lose weight. Weight is my favorite. Maybe it's normal for aging, my least favorite expression in all of healthcare. And instead, when we started saying, all these women can't be sleep deprived, all of these symptoms can't be related to a change in weight after menopause, let's look a little harder. And there is this absolutely second class of heart failure that is stiff hearts, that is more prevalent in women, that is more common across the world. And it wasn't until we asked the question, because we originally assumed that women made it up, women had secondary gain, it's all the other reasons, and we would poo-poo things instead of asking the questions and deep diving into why this happens. I'm Dr. Stacey Rosen, and I'm one of the voices of NEBGH.
I'm Samantha Borowsky, and I'm one of the voices of NEBGH.
I'm Rachel Snyder-Good, and I'm one of the voices of NEBGH.